Good morning, everyone. Thank you so much for joining this event and welcome again. My name is Seher Shafiq and I'm the Communities and Partnerships Editor at First Policy Response, which is a project at Ryerson University. Before we begin, I do want to give a land acknowledgement, and we do this as a symbolic restorative act, which is one among many to follow and part of a wider and hopefully transformative reconciliation project here at Ryerson. Ryerson University and the TVO headquarters are on the territory of the Anishinaabe, Haudenosaunee, and the Huron-Wendat. Is covered by the Dish with One Spoon Treaty, Treaty number 13, and the Williams Treaties. We are committed to honoring our obligations to these nations, treaties, and to justice for Indigenous peoples generally. In this project in particular, we hope to do that by creating spaces to feature Indigenous voices on our platforms, including through the FPR Contributors Fund, which supports submissions from underrepresented groups in the policy space. Before we jump into the conversation today, I do want to share a little bit about First Policy Response. FPR's goal is to bring the Canadian policy community together to highlight the best economic and social policy ideas that will keep us afloat and together during this time. Our focus is on those ideas that can get Canadians through the immediate crisis that we find ourselves in and prepare us for a sustainable and equitable recovery moving forward. We hope that the policy community, including frontline leaders and policymakers, and those in the private sector, labor, academia, and the non-for-profit sector, engage with us. We're especially keen to add voices and organizations that bring further diversity to our group and to this work. We will do our very best to amplify your work. We hope to help bring together the community of public policy first responders. As for today's event is a very special one. This town hall is a collaboration with TVO's The Agenda and with TVO.org. It's on a topic that we've been wanting to cover for a really long time: equity, economic recovery, and COVID-19. And we're so delighted that TVO has brought their talents and insights to work with us and to develop and deliver this event today. In just a few moments, I will pass the mic to Nam Kiwanuka, a host on TVO's The Agenda, who's going to be facilitating a moderated discussion with our four panelists. Following a 30 to 35 minute moderated and recorded discussion, Nam will disappear for a brief moment, but she'll be right back and we'll have an opportunity for audience Q&A. If you have a question that you'd like to ask the panel, we will be posting a link to slido.com. And you can enter the event code FPR9, and we'll include this in the chat, and you can post your questions there, and we'll pull from those questions. Just to note that parts of this event will be recorded and broadcast on TVO's The Agenda tonight. And lastly, feel free to follow the conversation on Twitter. The FPR handle is @PolicyResponse, and TVO's is @TheAgenda or @TVO. And with that, I will stop talking and I will pass it over to Nam.
Both the virus and the economic hardship that resulted from it have hit some parts of the Greater Toronto Area much harder than others. How come? In collaboration with Ryerson University's First Policy Response, we've assembled an expert panel to think about how to understand those disparities and to ensure a more equitable economic recovery. Let's introduce them. All in Ontario's capital city, Deputy Mayor Michael Thompson, Chair of Toronto's Economic and Community Development Committee. Jeffrey Schiffer, Executive Director for Native Child and Family Services of Toronto. Nakema Ray McManamna, Director of Policy and Research at the Canadian Black Policy Network. And Jennifer Yang, Health Reporter at the Toronto Star. Welcome to you all. Very happy to have you all. I know some of you, it's your first time, so it's nice to have you on the program. And just to set the table for our discussion, we do have a few maps I want to get through. So Sheldon, if you could please bring in the maps. Here's a map of the city's COVID-19 cases to date. Lots of cases in the northwest part of Toronto and parts of Scarborough. A couple of hotspots in East York, downtown, and Etobicoke, and very few cases in Midtown. We have another map here, and here's a map from the 2016 census of low-income neighborhoods in Toronto. Again, we see parts of Scarborough, the Northwest, East York, and downtown with higher percentage of low-income neighborhoods. Jennifer, I wanted to ask you the first question. We do see maps of Toronto, but obviously what's happening is not just isolated to the 416, correct?
That's right. The same patterns that we've seen playing out in the city of Toronto, where lower income neighborhoods, where more people are essential workers, more people live in cramped housing, are at higher risk of COVID-19. That's a pattern that's held true across not just the province, but the country and in other parts of the world as well. So some of these patterns you're seeing where the dark shaded parts of the map are sort of aligning with where people are also more lower income and working a lot of these essential jobs where they can't stay at home. That tends to be where COVID cases have concentrated.
And Deputy Mayor, what do these maps tell us about the unequal impact of COVID-19?
Well, I think the map tells us a lot, but I think it's really important for us to understand that COVID didn't create this problem. In fact, this problem existed, well before COVID, and really what it's demonstrating to us, though, that we have to act, we have to help people, and as has been stated before, the conditions of cramped housing, the conditions with respect to many of the frontline workers who are from specific areas who are predisposed to other issues such as lack of appropriate housing, food insecurity, lack of education, and so on. And so what it tells us is that we have lots of work to do. And in fact, we have to put not only policies in place and not only relying on government to actually do everything, but it is a collaborative approach as a society that we have to take the next step in order to address this inequality. It's intolerable that these conditions have been allowed to fester, and the pandemic has definitely shown us that there is a tremendous gap that has existed in our society that really needs to be addressed, and efforts are actually being made to address those. But at the same time, while we take these necessary steps and efforts to address them, we also have to measure for impact, because if we don't measure for impact, we will never know whether or not we're being successful.
And just to build on what the Deputy Mayor said, Nakema, he said that some of the conditions that we're seeing right now existed before the pandemic. The title of tonight's program is Equity, Economic Recovery, and COVID-19. What does equity look like to you?
Yeah, I think it's a great question, because equity is a word that, especially since all of the activism that we've seen over the course of the summer months, that has been tossed around a lot. But I think it's really important that we define the word. So equity for us is really about understanding that some communities have been disproportionately impacted by this pandemic. Those communities are reflected in geographic areas, but also ethnocultural communities. So we're focused on looking at the overrepresentation of Black communities in the number of COVID-19 cases. So when we think about responses and our economic recovery, equity means actually ensuring not just a one-size-fits-all approach, but targeted approaches that are actually going to address not just the crisis response to the disproportionalities we're seeing right now, but addressing the systemic issues, the root causes, the reasons why these disproportionalities have existed in the first place.
And Jeffrey, to build on what Nakema was saying, when we do think about recovery, one size fits all might not be what we're looking at. For the Indigenous community, how has the pandemic impacted the inequalities that the Indigenous community are experiencing in the city?
Sure, yeah. So, my fellow panelists have really hit the nail on the head with a lot of it. I think we're seeing Indigenous people in really dense urban environments where they need to go to work on overcrowded transit systems on a daily basis, and we're seeing rapid spread. But I think we also need to remember that this is not the first pandemic Indigenous people on Turtle Island have experienced, and there's a lot of intergenerational trauma about historical pandemics that have impacted communities. So alongside the historical issues that have been made more acute related to poverty and housing, we're seeing this secondary shadow pandemic related to mental health and, in some cases, substance abuse and family violence that is really becoming more acute in the face of this pandemic.
What you just said was really interesting in the sense that this is not the first pandemic that the Indigenous community has experienced. Why is that important for us to acknowledge?
I think it's important because we need to recognize that people are dealing with a lot of intergenerational trauma right now, and we need trauma-informed land-based tools and practices to be able to address the way that this pandemic is impacting Indigenous people. It also has a lot to do with vaccine hesitancy, right? Because Indigenous people have a very long history of, in fact, experimentation at the hands of settler medicine. And so when we tell Indigenous people now that they're a priority group for a vaccine, there's a lot of hesitancy around that because of historical trends. And so we're also working very hard to combat vaccine hesitancy right now in the community.
We were going to talk about vaccine hesitancy, but because you brought it up, I suppose we can go there right now. A lot of the discussions that I've been hearing when we do talk about vaccine hesitancy, it's kind of in the way that the responsibility is put on those communities to not be vaccine hesitant. Nakema, how should we be approaching this conversation?
Absolutely. You're right on that the conversation around vaccine hesitancy has been really individual and has mostly focused on addressing the misinformation that is out there. But as my fellow panelists noted, in Black communities, the systemic anti-Black racism in the healthcare system has had disastrous and fatal impacts for Black communities. So there are warranted low levels of trust between Black communities and healthcare institutions. And I think, earlier in this pandemic, there were some ideas around dedicated testing centers in those communities that were disproportionately impacted by the number of COVID-19 cases. And when we were talking to folks on the ground in their communities, they were like, I'm not so sure about this testing center. Our community is already so over-surveilled by police, by child welfare intervention. This just feels like another thing that's coming into our community, and we're not really sure about it. So combating vaccine hesitancy, I think there's been a lot of work to put accurate information out there, information that's accessible, and there's starting to be some work ensuring that that information is available in multiple languages. But I think how information about vaccines is distributed is another key component. So there are many Black-led organizations like the Black Health Alliance that are working on the ground in communities to be the voice distributing some of that information because they are trusted sources of information in the community. I'm really looking forward to understanding how, as the vaccine rollout takes place and is led by Toronto Public Health, they're going to be able to partner with Black-led organizations to support some of that distribution and combat that vaccine hesitancy.
And Deputy Mayor, I saw you nodding.
Yes, I'm just nodding because she's right. And in fact, that work has already been started. And it is very important that it's the grassroots organizations that our municipality is actually working with, because they're in the community. The community members know who they are. They are a trusted source of information and so on. Let me also say that it's extremely important for members of the community to ask questions and to be hesitant about taking the vaccine and so on, because, we've seen time and time again, and I know I participated on a forum last Saturday, and they talked about the Tuskegee experiment on Black people many, many years ago in the US, and those types of memories still linger. And, with respect to the systemic nature of racism and discrimination and so on, we've heard, people in the scientific community, not in Toronto, but international, who have talked about experimenting on Africans and so on. And those types of information actually is cemented in people's mind and their mindset. So there is a reluctance of acceptance, and there's a trust factor. But at the City of Toronto and with our Board of Health and our Toronto Medical Health, we have recognized the need to partner and to work with community organizations. And that requires us to invest with those organizations. And we are actually doing that work right now, because that's the only way that you're going to get cooperation.
And I want to go back for a moment to the map. And Jennifer, the northwest part of the city looks like it has been the hardest. Why is that the case?
So at the Toronto Star, we took a look at this question early in the spring when the first neighborhood map was released by Toronto Public Health, showing which neighborhoods had been hardest hit. And it was so striking to see that the northwest corner was really where cases had been concentrated in the city. And, we asked that question, why is this? And we tried to dive in and take a look at what might be going on. So our starting point was to ask, well, in lockdown, where are people possibly getting exposed to this virus? It's at work, it's at home. And, you also ask questions about access to healthcare and testing. So we kind of looked at those three areas. And what we learned was that in the northwest corner, it just happens to be that a number of issues, a number of factors are aligning to sort of create this perfect storm of vulnerability to the virus. And what are those factors? more people working in low wage essential jobs. For example, one community in the northwest corner, Mount Olive, that has had some of the highest cases since the beginning of the pandemic, has some of the city's biggest proportions of people working in manufacturing jobs. They also have some of the highest proportions of people living in unsuitable housing. So too many people cramped into a single household. And then you look at access to healthcare. In the northwest corner, historically, some people have referred to it as a primary care desert. There's just really poor access to primary healthcare. And when we got more data looking at testing access, this was also a part of the city where testing rates were really, really low. So all of those factors aligned and put the northwest corner of the city at highest risk.
Have lockdowns had any effect in reducing the spread, Jennifer?
So lockdowns do have an impact, but what we found was that in these higher burden neighborhoods, the measures put in place by policymakers take longer to come into effect in these hardest hit areas. So we did an analysis where we looked at the first spring lockdown and we compared how it impacted some of the wealthiest neighborhoods in the city where racialized populations were lowest. And we compared it to neighborhoods that were some of the lowest income where racialized populations were highest. And we found that the first spring lockdown almost immediately flattened the curve for some of these more privileged neighborhoods. But cases, in these lower income areas continued to rise for a while before they started to come down. So some of these light touch measures that will work immediately or quickly for a lot of the more affluent neighborhoods in the city and beyond, those measures just take a lot longer to come into effect and are often not quite enough to really end epidemics in these areas at all, because at the end of the day, people are still having to go to work day in, day out. So additional measures like paid sick leave probably need to come into play.
And Jeffrey, we've been hearing how we're all in this together, and we've been saying essential workers are heroes. But obviously, one of the things that's not working is this assumption that everyone can work from home. What would you like politicians to reconsider around that?
I think there's a number of things, really. I think there's been lots of conversations about the importance of creating climates where people do not need to go to work sick. So I think that it's important for us to create environments where people aren't going to the workplace when symptoms are apparent. And I think it goes further. I think that we also, really supporting daycares, creating safe environments in schools, and I think providing opportunities for people to go to work, safely is really critical.
And Deputy Mayor, not to put you on the spot, but I have to ask this question because I'm sure people are watching and listening to this conversation. One of the communities that we haven't spoken about are people who are experiencing homelessness, for example. And this pandemic has hit them in ways a lot of us can't even imagine. There's a young carpenter by the name of Khalil Seavright who made these little homes for people experiencing homelessness. But the city of Toronto is now taking him to court. People might want to know, why not work with him in finding a solution for people who have nowhere to stay, instead of using taxpayer dollars in a COVID environment where every dollar counts, to take him to court?
Sure. It's really important for us to understand what we are trying to do as part of our policy in the city of Toronto. We're trying to remove people from the encampment and putting them into indoor warm environments. We've actually been rather successful at that, but we know that there's a lot of people who need to be continued to be housed and to be sheltered and so on. We are focusing our tremendous amount of energy as well as resource. We're spending, for example, over $1.2 billion on providing assistance for housing for individuals who are in need. It's important also to understand with respect to these particular specific units that you talk about and these particular housing structure that are being built by this individual, they're actually not safe. That is not my word. It is the word of the deputy fire chief. They have actually viewed it to be unsafe. And so I don't think it's a situation where the city of Toronto can actually then support this type of accommodation in our parks and in our facilities. We want to actually remove people from the street and the encampment and put them in places where they're safe and they're well housed and they're warm. That is our effort with respect to trying to deal with this particular problem. We're investing a tremendous amount of resources. We're putting a lot of staff time, and we're actually been quite successful in terms of we've removed a significant number of people from the encampment. And I think it's important for us to ensure that we provide a safe environment for all those who are in need. So when we see a situation in which it is unsafe, we cannot endorse and we cannot support.
And just to push back a little bit, because I think some people
Sure.
might argue that being outside in the cold during a pandemic is more unsafe than being in your own private structure or even being in shelters.
So we believe that it's more important for people to be in a warm environment where there is support and wraparound support, which is what we're actually offering. And so the notion that would suggest that these structures would be safe vis-a-vis the expert opinion, we have to follow the expert opinion. And so I don't think it's a question of not wanting to help people. It is a question of wanting to help them in a safe and humane way. And that is the approach that we're actually taking to ensure that those residents who are in need are provided with the support that they want in a warm environment where they can have, let's say, a nice warm shower, they can have a meal, and can have additional support that they need until we can provide long-term housing solutions for them.
And Nakema, you know, I think one of the threads, the common threads in the past year during this pandemic is that a lot of problems that have existed in our society seem to be magnified on the backdrop of a pandemic. In your view, why is the pandemic impacting BIPOC communities in a more severe way?
Absolutely. So we've been having a lot of conversations with folks within our broader policy network about this. And when we started seeing all this data coming out about the overrepresentation of Black communities in the total COVID-19 cases, about the overrepresentation of Black communities in unemployment and job losses from the pandemic, folks around us were saying, none of this really feels new. In fact, it feels like COVID-19 has just exacerbated what we've already been seeing and the outcomes disparities we've already been feeling in our communities. And one of the reasons for that is that we've discussed is that anti-Black racism really serves to marginalize folks. And when you are so marginalized that you are sort of living paycheck to paycheck or on the brink, any sort of shock to your system is going to have a profound make it or break it impact on you and your ability to thrive. Before the pandemic, those shocks were really being felt at the individual level. So, you know, you might have seen community violence in a particular community or a death in an individual family. And Black communities are really good at coming together and supporting one another. But what has happened in the pandemic is now all of these things are happening at once, and these big shocks are being felt across the entire community. And our response to the pandemic is such that lockdowns are disabling the community to be able to come together and support one another. So I think that as we think about why this has been happening, yes, it's systemic anti-Black racism, and it's the way that marginalization has made it really challenging for folks to weather all of the shocks and challenges that are coming out of this pandemic.
And Jeffrey, you know, when we do think about moving forward and how we can build back better, a more equitable society, and given the challenges that we've been discussing in the past little bit, how does this affect our collective economic recovery?
You know, I think every time I hear the word or the phrase economic recovery, I always ask myself, whose economic recovery are we talking about? And so I do think that we need to take a holistic perspective and start to think about populations that historically have been marginalized and that historically have been impoverished to really maintain a high standard of living for particular folks in Canada. And so I think that we've spent a lot of time and a lot of effort, rightly so, on addressing sort of the surface impacts of COVID. I think it's really time for us to start looking at some of the structural issues, some of the deeper systemic structural issues that have been maintaining inequity when it comes to Indigenous peoples and peoples of color in the city of Toronto. And for me, that requires us to focus on stabilizing these families so that they have housing, so that they have the resources that they need, and then to begin to start defining really concrete pathways to sustainable prosperity for children, youth, and families across Toronto.
And Jennifer?
I agree completely with what my fellow panelists just said. You know, none of the issues that have put certain people at additional risk of COVID are new. This pandemic is socioeconomically driven and is also very tied to working conditions. So, you know, measures like paid sick leave are being called for in the pandemic but have been called for a long time, because people have always been having to go to work sick and choosing between, staying at home or making their rent that month. And, in the pandemic, there has been research showing that measures like paid sick leave can reduce the rates of COVID-19. There's research out of the US showing that states with paid sick leave measures have lower rates of COVID-19. There's research out of Israel showing that paid sick leave makes people more compliant with public health advice. So, these measures will help bring rates of COVID-19 down, but going forward, it will also enable people to work in a safe environment and to improve public health overall, because this is not the first infectious disease to come along. It won't be the last. We have flu seasons every year. So these measures really need to be looked at.
Businesses are struggling right now. And I know that a lot of people have been calling for paid sick leave, and the federal government and the provincial government keeps pushing it back to each other. But Jennifer, can businesses afford paid sick leave when they're struggling right now?
Well, I think there's a lot of research out there showing that it's a myth that it's going to cost businesses money to implement paid sick leave, because when you have a healthy workforce, you have more productive workers. And if you think about a worker showing up to the workplace sick, what's going to happen? There's contagion. They're going to spread their virus to their coworkers, who may also become so sick that they will have to stay home and potentially, lose out on their check that month. But infectious diseases are infectious, so if you can't support your workers to stay home, it's going to have a bigger impact on your overall workforce. So there really are incentives for businesses, I think, to take a look at measures like paid sick leave.
And Deputy Mayor, I know that the city has a lot of challenges in recovering from this pandemic, and we're looking at the summer. We're already seeing certain events being canceled. From your view, what would be the consequences of an uneven economic recovery be to the city?
Well, we would be in the same condition that we're actually talking about now in terms of the impact and the effect that it would have on a variety of people, particularly the BIPOC community and so on. And so when we talk about, for example, paid sick leave, which is something that we've been advocating to the other governments for, we're not just simply saying that we put the onus on business owners or small retailers who have been vastly impacted by the pandemic. We're saying that governments should be involved. So it's extremely important that they are involved. Some of the things that we're actually doing here at the City of Toronto, which is extremely important for us also to demonstrate our awareness and tangible things that we're doing. We are actually working with respect to offering training opportunities as well as buying equipment for people who are part of our program. So they have computers, they have connections to the internet and so on. So we change this imbalance in which we are aware in terms of some of the challenges that are impacting the community, where people aren't able to work at home in their computers and so on. We are trying to ensure that this unequal economic recovery that could take place doesn't take place. And of course, there's a lot of work to be done. There's no doubt about that. But it's also something that we have to recognize that governments have a role to play. The broader community, businesses have a role to play. Society in general have to collaborate and address the challenges that exist. We know where the problems are. We know what the solutions are. The question is, are we willing and able, are we interested in actually effectively bringing about the needed changes that are necessary in order to have this inequity that exists in our society addressed once and for all in terms of moving forward? Because as been stated, we will have other pandemics and other types of major challenges, both economic, social, as well as health challenges. Are we prepared? And we should be prepared, because there's no excuse in terms of moving forward.
We have less than 5 minutes left, but you said that we know what the solutions are. Can you give us some examples?
Sure. It's been said, not proper housing, lack of education for a lot of folks, the type of jobs that people are actually doing, the training that are needed. The provincial government made an announcement just yesterday about, providing free tuition for PSWs and so on. That's a really good start. There are other areas in which people will need help in terms of affording education. It's the high cost of education is also a barrier for a lot of people in terms of getting a good education. We know that going forward, education has always been a key equalizer for many people. I am the product of good education. That's why I'm here to talk to you. That's why I'm a member of Toronto City Council as a Black person living in this city, and who the members of your panels who are people of color, for example, would say to you that a solid education has helped them. So we have to help in terms of these, regards. We have to help single mothers with children. We have to actually help their children so that they can see better and brighter days and so on. So there's a lot of work to be done. And I think collectively, we have to recognize that we have to make the necessary investment in terms of housing, childcare that's needed, as well as activities in the cultural sector and so on to help young people. We haven't talked about young people much today, but we will tell there's a 22% unemployment rate for young people in our community. The other thing I wanted to say, and we talk a little bit about COVID, we have 9% of the city's population is Black. 26% of the COVID cases are affecting this community. That's a huge problem in terms of the impact on this community. And we know why, because they're the ones who are actually doing the jobs that can't be done by staying at home on your computer and so on. They're the ones who are at risk. They're the ones who are living in type of housing that is so commingled where they can't separate. And if breadwinner is sick, and don't go to work, they don't get paid. So there is the need for paid sick leave. And so one of the other things.
I want to get into, I'm sorry to interrupt you, Deputy Mayor, but I want to get in the other one, the other panelists, because we're running out of time, but I'm sure we will go into our conversation again. Nakema, what do you think of that response?
Yeah, so the one piece that I want to bring in is the Deputy Mayor talked a lot about how the Black community, we are the ones on the front lines doing this work. And as a result, I think we are the ones who should be involved in the policy solutions to support this economic recovery. I think we do a really good job at asking Black communities what the problems are, and then we develop these reports, and then decision makers go away behind closed doors, develop these solutions, and then roll them out into the community. I think Black community voices need to be at the center of not just identifying the problems, but actively co-designing and collaborating on the policy solutions. I think there's been some of that work has started, but I look forward to seeing the ways that the municipal government, federal and provincial governments are going to center Black voices in those bigger policies that are going to actually address the systemic root causes that have resulted in these disproportionalities in the first place.
And Jeffrey, I'll give you the last 30 seconds.
Thank you. So thank you, Deputy Mayor, for bringing up children. All I want to say is our limit for systems transformation and innovation is often, based on the diversity of the people that we have in the room. We've been talking a lot about equity today, and I think that we need to invest in our kids. When the recent UNICEF report card came out, it shows that Canada invests way less in our children than other countries of our size. We need better daycares. We need better schools. We need to be supporting the growth and development and economic prosperity of diverse kids, so they can enter the workforce and add to the toolkits that we have for systems transformation. And I'll just leave it there. Miigwech.
I really do thank all of you for being here today. And there's lots more to talk about. Maybe we can do this again some other time. But I do think that the environment that we're in, the pandemic, it gives us an opportunity to build back better, as they keep saying. Thanks so much for your time. We appreciate it.
Thank you very much.
Thank you.
Thank you.
So in a moment, everyone will be back to answer your questions. Just a note, our friends at TVO actually can't see the Zoom chat. So if you have any questions, please.
Hi, everybody. Sorry, I'm just grabbing my computer, and I'm not sure if people can hear me. Ryerson? Oh, lots of questions. So that was great. Thank you so much. I'll let you all get a glass of water. And the 30 minutes goes by very, very fast. So yeah. Sheldon, how do I do this now? Do I okay. So we do have a fair bit of questions, and okay. Thanks so much for that great discussion. We've got a number of questions from people who were listening in and watching. I don't see the questions being addressed to anybody. So what I'll do is I'll start with Jennifer. And Jennifer, there's a question from Anonymous. And the question is, how can all levels of government work better together to address some of the issues discussed today?
Oh, that's a really good question. And I'd love to hear what the deputy mayor has to say about that as well. You know, I think, there definitely has been disconnects that we've witnessed, I think, throughout the pandemic, where at the local level, municipalities have been asking for measures from the province. And then we've seen too at the provincial level where they've taken issue with things happening at the federal level. I'm not privy to the conversations that happen behind closed doors. But it does seem to me that I'm noticing the disconnects between the various levels of government. And that's very much a question that I have as well, actually. So I don't think I have an answer.
Deputy Mayor, I'll let you take it then.
Yes, thank you. I mean, there's always that view that there is a disconnect. I think that the pandemic and the approach that we've taken in recognizing the need for governments to continue to collaborate, but collaborate in a more effective way that demonstrates that we're actually acting and responding to the needs and the requirement of our society. It was mentioned before that, the people who are impacted the most should be part of the process as part of the decision making. We know that a lot of what we need to do requires resources and investment into community to create this empowerment and so on. So there's a lot of work that's actually being done. And I think that clearly the public will hold us accountable if we don't actually collaborate in order to address the challenges that we know existed before the pandemic and that has continued and that has been obviously been more magnified as a result of the pandemic. So there's a lot of work that's going on. There's a lot of advocacy. And we just want to ensure that the resources that are needed that are invested in the places that they're needed. And at the same time, there's a demonstration of the collaboration that's also necessary in order to build capacity and ensure that people are working with us to bring the outcomes that are so badly needed.
Okay, so I think what I'm going to do is I'm going to read the question. And if you would like to take the question, you can just raise your hand. The next question is, what policies do we need to move towards economic recovery? How does the equity discussion intersect with economic recovery?
Yeah, I can start with it. So I think that there is, our collective economic recovery actually hinges on addressing equity. Right now, we're in these early stages of kind of seeing a light at the end of the tunnel to emerge from this pandemic. And part of that emerging is actually vaccines. But all of the language that I've heard about vaccines is that we need the majority of the population to get it in order to have this herd immunity. But that majority has to be evenly sort of distributed across not just geographic communities, but cultural communities as well. So continuing to leave some communities out of our recovery from the pandemic actually puts all of us collectively at risk, because if everyone doesn't, get the vaccine or the majority doesn't, then we are in a situation where we will not have that sort of safety net from a health and safety perspective. As far as the economic piece, I think that the deputy mayor spoke about collaboration, and we are in a bit of a moment where all three levels of government have collaborated unlike any time before because of these unprecedented times. So there is an opportunity to maybe take advantage of this window to support greater collaboration. And that collaboration might trigger some more innovative economic policies and responses to move out of this recovery.
Jeffrey, did you want to add to that?
No, I mean, I just think that the only thing I would add is that I think we need to keep reconciliation front and center here as well. And I always find that it's helpful to make a distinction between equity and reconciliation. 100%, we need equity-seeking groups involved in this work. I think that I think we've talked a lot about collaboration between the three levels of Canadian government, forgetting that we have this fourth level, Indigenous government, which is really a critical piece of this puzzle. And so I think that ensuring collaboration between the three levels of Canadian government together on a nation-to-nation basis with Indigenous governments is also going to be very, very critical to moving forward in a good way.
And just to add on to that, I might be wrong with my information, but there's a lot of Indigenous communities in the city. A lot of Indigenous people live in the city. How does that impact the money that they get from the government, Jeffrey, for the pandemic?
For sure. So it's a very complicated thing, right? Ontario is the most populous province in Canada when it comes to Indigenous people. And at any given time, 20% of that population is right here in the city of Toronto. So 70 to 80,000 Indigenous people in the city of Toronto, representing dozens and dozens of different First Nations, some of them status, some of them non-status. So yes, many of them are registered under the Indian Act and have access to federal money. Others are non-registered and don't, and are required the support of urban Indigenous agencies like Native Child and Family Services of Toronto or Anishinaabe Health Toronto or Council Fire or many others. So as the framework evolves and as we see these emerging urban Indigenous populations, it also becomes increasingly important to have urban Indigenous organizations and collectives involved in this process.
The next question we have is, how is system thinking and the allocation of data going to get back to the right people to create change? Who would like to take that?
I'm sorry, can I try?
Take a stab at this one.
Okay, Jennifer.
The deputy. So, I mean, I think we, just to sound a bit like a broken record, I think getting the data back into the communities that need this data and that will be empowered by this data is, again, to ensure that the communities for which data is collected have a seat at the table in determining how the data is collected, how it's analyzed, and importantly too, how it's communicated and then acted upon. So again, I think for Black communities, racialized communities, Indigenous communities, it's extremely critical that people from these communities, organizations from these communities, have an empowered and central role in the data collection in the first place and in determining how this data is used.
And Deputy Mayor?
And if I could just add, like, you know, if he or she who feels it the most isn't part of the resolution to address the issues that they're feeling, then clearly you're not going to address the challenges that they're facing to their satisfaction. But data is extremely important because data is actually it is important for us as decision makers. It informs us, it helps us to decide how to allocate resources to help individuals and help collective in terms of community as a whole. At the end of the day, what we're talking about is resources in terms of that's needed to address the challenges and the problems that we are facing. Let me also add as well, one of the things that we really need to be looking at as we move forward is that we need to be looking at, you know, workforce development and talent development and so on. So as we look at economic recovery, what does the future of work look like for all of the different groups in our society? How are they trained? How are they being prepared for the next opportunity in terms of work and development? What is the professional requirement that's needed, and how do they get that? And what type of resources are going to be available to them? The data can actually help us with respect to not only the analysis, but the actual decision that we make to create that impact.
We have a really great question here. It keeps moving and I just lost it. 1 second, where did it go? Oh my goodness. Oh, okay. Are there plans to collect and publish COVID-19 data for people with disabilities? Evidence from the US and UK shows that there are disproportionate COVID-19 cases and deaths. Would like
so I can just take a stab at that quickly. I know that the medical officer of health is actually looking at disaggregated data for a lot of different groups in our society. So I would say to you a quick yes, and the details obviously will come forward because we know that people with disabilities and the BIPOC and Black community, for example, have been affected differently as a result of COVID. And I think we need to have a better, more informed understanding in order to then help us to be able to make decisions. As it's been stated before, these pandemics will occur again, and we want to find ourselves in the same situation and not being able to be mobilized and be ready. I would say the answer is no. So we definitely will be utilizing this information, and the data is extremely important.
How to realize employment equity legislation, federal, provincial, municipal, comprehensive, expanded to include 2S LGBTQ+, consistently disaggregated, enforced. Would like to take that.
So, you know, I will say to you that as we roll out a variety of different initiatives as part of the economic recovery, we have to look at all of the different sectors and all of the different groups in our society and so on. So all of the groups that are part of our community and as part of our society are going to be viewed in a lens that is of interest and to ensure that there is inclusion, which is extremely important as part of our movement forward and so on. So as we move forward, we have to look at inclusion, and we talk about anti-racism and discrimination and so on. These are all part of the factors that we have to address going forward.
Another question, this is about around vaccines. And the question is, what are some of the trusted organizations working on the ground that we can refer racialized community members to who are hesitant about getting the vaccine?
Yeah, so I mentioned in the other piece around the Black Health Alliance is doing some work with the University of Toronto Black Students Association for the Medical School to distribute information about COVID-19. However, I do know, and perhaps the Deputy Mayor can speak more to this, that as a result of establishing the Black Scientists Council, community-based organizations have been tapped to help do some of that outreach. I think Taibu Community Health Center is one of those organizations. I will say, though, that we started this session with the maps and showing how the disproportionate impact of cases within different communities and combating vaccine hesitancy within Black communities has to also be hyper targeted to those geographic communities by knowing who are the trusted sources on the ground. Sometimes that is a big community health center like Taibu. Sometimes it's a super grassroots advocacy group. Sometimes it's a sort of a community leader. So I think in Regent Park, there's a large group of Somali women who are moms who have been doing a lot of work in the community to combat vaccine hesitancy at a very, very grassroots level. So I think there's a mixture of different types of organizations that are engaged in this work.
Cities drive the economy with health and education. How can cities be legislatively empowered to push those levers for residents, communities, and businesses?
So I would say that it's true. Cities around the world are actually driving their national economy, and Toronto is no different. In fact, we represent 22 to 24% of the GDP for this entire country. And so we are working with respect to engaging and ensuring that as we move forward, all of the different variables and so on that we must address are being addressed. We may not have it perfectly going forward, but it is important to understand that there are entrees and on-ramps into the process for everyone to be involved. And it's a collective approach in terms of our efforts to build back better and to be successful. It isn't simply that government alone will be the ones. Government can actually set the conditions and the playing field and so on, but there's a vast array of individuals and organizations, both in terms of NGOs and so on, who are going to play a tremendous role as we move forward. When we talk, for example, about development in the City of Toronto, we talk about community benefits in terms of how we can expand and create opportunities for people in communities to be able to have good paying jobs, working with union organizations and so on. It's extremely important that we all roll up our sleeves and work together for the, the economic success that we want to see and the prosperity that we need in the city for all.
There's an email here around shelters, and it says a Star article from yesterday identified a new outbreak with a variant strain at 2 shelters this month in the downtown East End. How will shelters be made safer? Deputy Mayor.
Sure, thank you. There's a lot of work that's actually being done. Obviously, we know that we need to create better safety in our shelter system in terms of distancing and so on, but also investing in the staff and investing certainly into the development of facilities. I know of the shelters that your questions refer to, and there's a lot of work that's actually being done with respect to they're not city-owned facilities, but they're agencies that the city is working in collaboration with in order to ensure that we can obviously address the spread that's actually taking place of the variants. And it's something that the medical officer of health is working along with our shelter and support staff.
This is a great question. Is there a danger of diversity, equity, and inclusion fatigue? What to say to people who roll their eyes at these issues? Who would like to take that?
Well, I'll try if you don't mind. Is that okay? Listen, I hear this time and time again. In fact, just late last night, I received 2 phone calls from staff in the city who have said to me, other non-Black employees are saying that, too much is being done already. And these people are crying, they're whining, and they're getting too much as it is. That's really not the case, which is unfortunate. So we have to educate people to understand what's actually taking place. And for those people who have always been left behind, the fact that there is a little bit of effort to catch up and other people are saying, you've had enough already. It's clearly a situation where we need to educate people as to the benefits so that at the end of the day, the views will not be strongly held.
And just to go off what Nakema said earlier, we're all in this together. If one community is affected, we're all affected. This might be a good follow-up. Could panelists share their views on incorporating lived expertise of poverty, homelessness, housing needs, et cetera, into policymaking?
Yeah, so I would be happy to start with that one because I think it builds off of what I was talking about with regard to including Black communities at this and centering Black voices in our economic response. I think that, we are moving in a direction where we are starting to value and recognize lived experience and lived knowledge as being valuable knowledge in the policy development process. It used to be very much the case that, decision makers are the experts and they're over here, and communities are purely the recipients or the clients of these policies. We have, seen in the last several years, but in particular as a result of this pandemic, a coming together and a recognizing folks with lived experience as having valuable insight into the process. I think the challenge now is that we mostly engage communities and folks with lived experience when we're trying to really hone in and identify the problem. And I think there's lots of room for folks with lived experience to share their experience and say, well, here's what I think would work for me to ameliorate my situation. And that's not just powerful for decision makers to get, valuable information. It also helps to ensure that resources are allocated towards the initiatives that are actually going to make an impact. And it empowers the community. When folks feel like they have a voice in the decisions that are being made for them and about them, it can really empower them and lift them up as a whole.
We have about 5 minutes left, but I'd love to get an answer from all of you. Jeffrey, would you like to?
I'm echoing everything that was just said. Phenomenal. I mean, I think the advent of community advisory committees. I mean, I think when we're opening new sites and looking at policy revision and collaboration with government, we ground it in elders, knowledge keepers, community advisory circles. So I think the more that we can get folks that are involved in services and policy at that table, providing lived experience and perspectives, the better the outcomes are going to be. And so we're going to see financial savings. We're going to see better outcomes. Multiple levels of government are moving in this direction already, and I think we need to keep it central to COVID response and recovery as we continue this journey together.
And Jennifer?
Something I wanted to mention is that the pandemic has been this traumatic, devastating tragedy, of course, but there have been some silver linings and opportunities that have opened up as a result. And I think one of the positive outcomes we've seen in the pandemic is an appreciation of the expertise of people with lived experience, because these people have been called into action by the pandemic response. And an example I can think of is in the homeless recovery hotels. A lot of collaboration between hospitals, Toronto Public Health, and shelter workers came together to create these spaces where homeless people could go to recover from COVID-19 or to wait for their test results. And a piece that was brought into these recovery centers were peer workers with lived experience. So people who have been recently, living on the streets or who have addiction issues that they're combating themselves, but stable enough in their lives to be able to work and support their peers. And the feedback from this has been tremendous. These peer workers have been recognized as being completely critical to the success of some of these recovery centers. And I think there's a broad acknowledgement that they couldn't have happened. They couldn't have worked without these peer workers with lived experience. And those lessons have now been learned. And, I think hospitals and other institutions that have not necessarily worked with peers or people with lived experience or sort of valued their expertise as much or centered it are seeing that in action, the power of it. And that's translating into real changes now. University Health Network, for instance, has now introduced a peer worker program into its emergency room. And that's something that was sort of connected to this work we saw through COVID. So yeah, I think the pandemic has kind of opened a new door for just sort of putting people with lived experiences at the center of some of these issues and these responses.
And Deputy Mayor, I'll let you have the last 2 minutes.
Sure. When you're vested in your interests, and that is your community development, community interests, and so on, you look at the foundational engagement that people will require and need to ensure that they are able to see the benefit of the outcome because they have a stake in the interest, and as been stated by the other panelists and so on. When people are engaged in terms of coming up with great ideas to help themselves and are invested in the approach, the outcome are so much better. And you build capacity, you build that collaboration which is needed in order to sustain a healthy growth and healthy development in community and in society in general, because it has to be about the bottom up that creates the change. It can't be the top down approach that we've seen that has failed us time and time again. And so the pandemic has created an opportunity to change the paradigm shift in order to ensure that we build from the bottom better, as opposed to thinking that we can build from the top down and making it better. It actually makes it worse that way. So we really need to learn and learn the lesson fast to be able to build for prosperity and to ensure that everyone is involved in the success of the economic recovery that is so badly needed.
Thank you so much, all of you. That's all the time we have. I've learned a lot, and I hope everybody that's been listening has also learned a lot. We really appreciate you making the time for us as well. So stay well, everybody. Keep safe, and make sure you wear those masks. Thanks again.
Thank you.
Indeed. Thank you very
Thank
much.
you.
Bye-bye.
Bye-bye.
Take care.
Bye, panelists.
Bye.
Stay safe. All the best.
Bye.
Thank you.
Thank you.
Bye.
Well, thank you so much, everyone. That brings us to the end of our event. Wanted to give a huge thanks to everyone who helped to make this event happen after months and months of planning. The core team at First Policy Response, including Kareem Bardisi, Matthew Mendelson, Stephanie McClellan, Katria Bolger, Famida Kamali, Braylon Guppy. To our partners at TVO, thank you for all of your support in planning this event. Stacey Dunseith, Colin Ellis, Mark Ford, and of course, Nam for moderating. To our speakers, Nakema, Jeffrey, Jennifer, Deputy Mayor, thank you so much for sharing your candid insights and perspectives with us. And to the audience, to all of you, thank you for joining this important conversation. I wanted to point out we do have a series of columns on this topic being presented in partnership with TVO, and we're looking at different aspects of how COVID is affecting Black and racialized communities and how policymakers should respond. You can read these pieces on policyresponse.ca and also tvo.org. You can also visit policyresponse.ca to sign up for our Friday newsletter and to find links on how to write or pitch your articles and ideas to us. And lastly, a recording of this event will be broadcast tonight at 8 p.m. on TVO, YouTube, Twitter, and Facebook, with catch-up viewing at the Agenda's YouTube page and tvo.org/theagenda. So that's all from us. Thank you so much, and we hope to see you again soon.